Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 practice NCLEX questions. Without delay, let's get started.
A prima gravida client at 36 weeks gestation with premature rupture of the membranes is to be discharged home on bed rest with follow-up by the home health nurse. After instruction about care while at home, which of the following client statements indicates effective teaching? 1. It is permissible to douche if the fluid irritates my vaginal area. 2. I can take either a tub bath or a shower when I feel like it. 3. I should limit my fluid intake to less than 1 quart daily. 4. I should contact the doctor if my temperature is 100.4 degrees Fahrenheit or higher. The correct answer is 4. Because of the client's increased risk for infection, successful teaching is indicated when the client states that she will contact the doctor if her temperature is 100.4 degrees Fahrenheit or greater. The client should be instructed to monitor her temperature twice daily. The client should refrain from douching and tub bathing, which can increase the potential for infection. Showering is permitted because water in the shower doesn't enter the vagina and increase the risk of infection. A fluid intake of at least 2 liters daily is recommended to prevent potential urinary tract infection. Which of the following diets would be most appropriate for a client with chronic obstructive pulmonary disease? 1. Low-fat, low-cholesterol diet. 2. Bland, soft diet. 3. Low-sodium diet. 4. High-calorie, high-protein diet. The correct answer is 4. The client should eat high-calorie, high-protein meals to maintain nutritional status and prevent weight loss that results from the increased work of breathing. The client should be encouraged to eat small, frequent meals. A low-fat, low-cholesterol diet is indicated for clients with coronary artery disease. The client with COPD does not necessarily need to follow a sodium-restricted diet, unless otherwise medically indicated. There is no need for client to eat bland, soft foods. A prima gravida client at 34 weeks gestation is experiencing contractions every 3 to 4 minutes, lasting for 35 seconds. Her cervix is 2 centimeters dilated and 50% effaced. While the nurse is assessing the client's vital signs, the client says, "I think my bag of water just broke." Which of the following would the nurse do first? 1. Check the status of the fetal heart rate. 2. Turn the client to her right side. 3. Test the leaking fluid with nitrazine paper. 4. Perform a sterile vaginal examination. The correct answer is 1. The priority is to determine whether a prolapsed cord has occurred as a result of the spontaneous rupture of membranes. The nurse's first action should be to check the status of the fetal heart rate. Complications of premature rupture of the membranes include a prolapsed cord or increased pressure on the fetal umbilical cord, inhibiting fetal nutrient supply. Variable decelerations or fetal bradycardia may be seen on the external fetal monitor. The cord also may be visible. Turning the client to her right side is not necessary. If the cord does prolapse, the client should be placed in a kneaded chest or Trendelenburg position. Checking the fluid with nitrazine paper and vaginal examination are appropriate once the status of the fetus has been evaluated. A client with chronic obstructive pulmonary disease is experiencing dyspnea and has a low PO2 level. The nurse plans to administer oxygen as prescribed. Which of the following statements is true concerning oxygen administration to a client with COPD? 1. High oxygen concentrations will cause coughing and dyspnea. 2. High oxygen concentrations may inhibit the hypoxic stimulus to breathe. 3. Increased oxygen use will cause the client to become dependent on the oxygen. 4. Administration of oxygen is contraindicated in clients who are using bronchodilators. The correct answer is 2. Clients who have a long history of COPD may retain carbon dioxide. Gradually, the body adjusts to the higher CO2 concentration, and the high levels of CO2 no longer stimulate the respiratory center. The major respiratory stimulant then becomes hypoxemia. Administration of high concentrations of oxygen eliminates this respiratory stimulus and leads to hypoventilation. Oxygen can be drying if it is not humidified, but it does not cause coughing and dyspnea. Increased oxygen use will not create an oxygen dependency. Clients should receive oxygen as needed. Oxygen is not contraindicated with the use of bronchodilators. A client with gestational diabetes who is entering her third trimester is learning how to monitor her fetus's movements. After teaching the client about the kick count, the nurse should provide further instruction if the client makes which of the following statements? 1. The baby may be more active at different times of the day. 2. How I feel my baby move is different than my friend. 3. The baby should be moving less than 10 times in 2 hours. 4. The baby may not move at times because it is asleep. The correct answer is 3. Feeling 4 kicks in 30 minutes or feeling 10 or more kicks in 2 hours are norms. Fetuses are more active at various times of the day, particularly after mother has eaten when the blood glucose level is high, and in the evening. Each individual perceives their fetus to move differently. Fetuses do sleep several times per day for about 30 minutes each time. The nurse assesses the respiratory status of a client who is experiencing an exacerbation of chronic obstructive pulmonary disease secondary to an upper respiratory tract infection. Which of the following findings would be expected? 1. Normal breath sounds. 2. Prolonged inspiration. 3. Normal chest movement. 4. Coarse crackles and rhonchi. The correct answer is 4. Exacerbations of COPD are commonly caused by respiratory infections. Coarse crackles and rhonchi will be auscultated as air moves through airways obstructed with secretions. In COPD, breath sounds are diminished because of an enlarged anteroposterior diameter of the chest. Expiration, not inspiration, becomes prolonged. Chest movement is decreased as lungs become overdistended. A 27-year-old prima gravida client with insulin-dependent diabetes at 34 weeks gestation undergoes a non-stress test, the results of which are documented as reactive. The nurse should tell the client that the test results indicate which of the following? 1. A contraction stress test is necessary. 2. The non-stress test should be repeated. 3. Chorionic villus sampling is necessary. 4. There is evidence of fetal well-being. The correct answer is 4. The non-stress test is considered reactive when 2 or more fetal heart rate accelerations of at least 15 BPM occur, along with fetal movement, during a 10 to 20 minute period. A reactive non-stress test indicates fetal heart rate accelerations and well-being. There is no indication for further evaluation. However, contraction stress tests are commonly scheduled for pregnant clients with insulin-dependent diabetes in the latter part of pregnancy and are repeated periodically until birth. Chorionic villus sampling is usually performed early in the pregnancy to detect fetal abnormalities. The nurse teaches a client with chronic obstructive pulmonary disease to assess for signs and symptoms of right-sided heart failure. Which of the following signs and symptoms should be included in the teaching plan? 1. Clubbing of nail beds. 2. Hypertension. 3. Peripheral edema. 4. Increased appetite. The correct answer is 3. Right-sided heart failure is a complication of COPD that occurs because of pulmonary hypertension. Signs and symptoms of right-sided heart failure include peripheral edema, jugular venous distension, hepatomegaly, and weight gain due to increased fluid volume. Clubbing of nail beds is associated with conditions of chronic hypoxemia. Hypertension is associated with left-sided heart failure. Clients with heart failure have decreased appetites. A prima gravida client with insulin-dependent diabetes tells a nurse that the contraction stress test performed earlier in the day was suspicious. The nurse interprets this test result as indicating that the fetal heart rate patterns showed which of the following? 1. Frequent late decelerations. 2. Decreased fetal movement. 3. Inconsistent late decelerations. 4. Lack of fetal movement. The correct answer is 3. A contraction stress test is used to evaluate fetal well-being during a simulated labor. A suspicious contraction stress test indicates inconsistent late deceleration patterns requiring further evaluation. A negative contraction stress test indicates no late decelerations and is a desired outcome. A positive contraction stress test indicates fetal compromise with frequent late decelerations. Fetal movements are one of the parameters of biophysical profile and are detected with non-stress testing. Decreased or absent fetal movements may indicate central nervous system dysfunction or prematurity. Lack of fetal movement or decreased fetal movement is not associated with contraction stress testing. The nurse reviews a client's electrolyte results and notes that the potassium level is 5.4 milliequivalent per liter, which should the nurse observe for on the cardiac monitor as a result of this laboratory value. 1. ST elevation. 2. Peak P waves. 3. Prominent U waves. 4. Narrow peak T waves. The correct answer is 4. A serum potassium level of 5.4 milliequivalent per liter is indicative of hyperkalemia. Cardiac changes include a wide, flat P wave, a prolonged PR interval, a widened QRS complex, and narrow peak T waves. Which of the following statements about a fetal biophysical profile would be incorporated into the teaching plan for a prima gravida client with insulin-dependent diabetes? 1. It determines fetal lung maturity. 2. It is non-invasive using real-time ultrasound. 3. It will correlate with the newborn's APGAR score. 4. It requires the client to have an empty bladder. The correct answer is 2. The fetal biophysical profile, a non-invasive test using real-time ultrasound, assesses 5 parameters: fetal heart rate reactivity, fetal breathing movements, gross fetal body movements, fetal tone, and amniotic fluid volume. Fetal heart rate reactivity is determined by a non-stress test. The other 4 parameters are determined by ultrasound scanning. The results are available as soon as the test is completed and interpreted. The lecithin-sphingomyelin ratio is used to determine fetal lung maturity. Although the fetal biophysical profile is useful in predicting which fetuses may be at greater risk for compromise, there is no correlation with the newborn's APGAR score. The biophysical score is sometimes referred to as the fetal APGAR score. A score of 8 to 10 indicates fetal well-being. Use of an ultrasound requires the mother to have a full bladder. A client arterial blood gas values are as follows: pH 7.31, PaO2 80 millimeters of mercury, PaCO2 65, HCO3 36 milliequivalents per liter. The nurse should assess the client for 1. Cyanosis, 2. Flushed skin, 3. Irritability, 4. Anxiety. The correct answer is 2. The high PaCO2 level causes flushing due to vasodilation. The client also becomes drowsy and lethargic because carbon dioxide has a depressant effect on the central nervous system. Cyanosis is a sign of hypoxia. Irritability and anxiety are not common with a PaCO2 level of 65, but are associated with hypoxia. A 30-year-old multigravida client at 8 weeks gestation has a history of insulin-dependent diabetes. Since age 20, when explaining about the importance of blood glucose control during pregnancy, the nurse should tell the client that which of the following will occur regarding the client's insulin needs during the first trimester. 1. They will increase. 2. They will decrease. 3. They will remain constant. 4. They will be unpredictable. The correct answer is 2. During the first trimester, it is not unusual for insulin needs to decrease, commonly as a result of nausea and vomiting. Progressive insulin resistance is characteristic of pregnancy, particularly in the second half of pregnancy. It is not unusual for insulin needs to increase by as much as 4 times the non-pregnant dose after about the 24th week of gestation. This resistance is caused by the production of human placental lactogen, also called human chorionic somatotropin, by the placenta and by other hormones, such as estrogen and progesterone, which are insulin antagonists. Which of the following is a priority goal for the client with chronic obstructive pulmonary disease? 1. Maintaining functional ability. 2. Minimizing chest pain. 3. Increasing carbon dioxide levels in the blood. 4. Treating infectious agents. The correct answer is 1. A priority goal for client with COPD is to manage the signs and symptoms of the disease process so as to maintain the client's functional ability. Chest pain is not a typical symptom of COPD. The carbon dioxide concentration in the blood is increased to an abnormal level in clients with COPD. It would not be a goal to increase the level further. Preventing infection will be a goal of care for the client with COPD. The nurse explains the complications of pregnancy that occur with diabetes to a prima gravid client at 10 weeks gestation who has a 5-year history of insulin-dependent diabetes. Which of the following, if stated by the client as a complication, indicates the need for additional teaching? 1. Candida albicans infection. 2. Twin-to-twin transfer. 3. Polyhydramnios. 4. Preeclampsia. The correct answer is 2. Clients who are pregnant and have diabetes are not at greater risk for multi-fetal pregnancy and subsequent twin-to-twin transfer unless they have undergone fertility treatments. The pregnant diabetic client is at higher risk for complications such as infection, polyhydramnios, ketoacidosis, and preeclampsia compared with the pregnant non-diabetic client. Which of the following is an expected outcome of pursed lip breathing for clients with emphysema? 1. To promote oxygen intake. 2. To strengthen the diaphragm. 3. To strengthen the intercostal muscles. 4. To promote carbon dioxide elimination. The correct answer is 4. Pursed lip breathing prolongs exhalation and prevents air trapping in the alveoli, thereby promoting carbon dioxide elimination. By prolonging exhalation and helping the client relax, pursed lip breathing helps the client learn to control the rate and depth of respiration. Pursed lip breathing does not promote the intake of oxygen, strengthen the diaphragm, or strengthen intercostal muscles. When developing a teaching plan for a prima gravida client with insulin-dependent diabetes about monitoring blood glucose control and insulin dosages at home, which of the following would the nurse expect to include as a desired target range for blood glucose levels? 1. 40 to 60 milligrams per deciliter between 2 o'clock and 4 p.m. 2. 70 to 100 milligrams per deciliter before meals and bedtime snacks. 3. 110 to 140 milligrams per deciliter before meals and bedtime snacks. 4. 140 to 160 milligrams per deciliter 1 hour after meals. The correct answer is 2. The goal is to maintain blood plasma glucose levels at 70 to 100 milligrams per deciliter before meals and bedtime snacks. Below 60 milligrams per deciliter indicates hypoglycemia. A range of 110 to 140 milligrams per deciliter suggests hyperglycemia. The target range 1 hour after meals is 100 to 120 milligrams per deciliter. When instructing clients on how to decrease the risk of chronic obstructive pulmonary disease, the nurse should emphasize which of the following? 1. Participate regularly in aerobic exercises. 2. Maintain a high-protein diet. 3. Avoid exposure to people with known respiratory infections. 4. Abstain from cigarette smoking. The correct answer is 4. Cigarette smoking is the primary cause of COPD. Other risk factors include exposure to environmental pollutants and chronic asthma. Participating in an aerobic exercise program, although beneficial, will not decrease the risk of COPD. Insufficient protein intake and exposure to people with respiratory infections do not increase the risk of COPD.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.